Thank you, Médecins Sans Frontières International. And I now give the floor to the representative of Stitching Health Action International. Stitching Health Action International, you have the floor.
Honorable Chair and distinguished delegates, on behalf of HAI, UAEM, and KEI, we welcome WHO's attention to innovation and intellectual property in the context of global health. Last year, the WHO recognized the far-reaching consequences of trade agreements on access to medicines, as Dr. Margaret Chan said, quote, "If these agreements open trade yet close access to affordable medicines, we have to ask, is this really progress at all?" End quote. Broad multilateral trade agreements currently under negotiation, including the Trans-Pacific Partnership, TPP, and the Transatlantic Trade and Investment Partnership, TTIP, threaten signatories' rights to use flexibilities under international TRIPS regulations to protect their population's health. This will profoundly harm global health, not least by setting back global efforts to ensure treatment needs for an AIDS-free generation. A functional GSPOA is urgently needed to address gaps in access to life-saving medicines. HAI, UAEM, and KEI therefore urges the WHO to respond to this call for leadership by calling on member states not to adopt free trade agreement provisions that undermine their public health needs at home. Secondly, we also call upon the WHO to quickly move to implement points 5 and 6.3 of the GSPOA, providing assistance to countries wishing to exercise their rights under TRIPS. WHO should fulfill its GSPOA mandate to implement the principles of de-linkage, that is, to address the business models that separate the cost of R&D from the price of health products. Finally, we appeal to the WHO Secretariat to increase transparency in the extension process and new evaluation procedures. The world stands at a critical juncture. We have effective treatments and vaccines for more diseases than ever before, but they remain out of reach for many peoples, especially in low-resource settings. Trade agreements such as the TPP threaten to exacerbate the situation, denying life-saving medicines for as many as 500 million people. Ensuring that health is protected against these countervailing forces will require a strong and effective GSPOA. Thank you.